Hi, I'm Valerie Bartles. I'm a P4 student right now on rotation with Dr. Hamilton. We're doing this video to help clear up some confusion about antihistamines and decongestant use and how they work in allergies. So, histamine is released from mast cells in response to an exposed allergen that the body recognizes via IgE antibodies. There are 4 subtypes of histamine receptors, H1 through H4. Histamine 1 receptors are found in smooth muscle endothelium and the brain. This subtype has the most effects in allergic response, so we'll focus on antihistamine 1 blocking agents. Histamine 1 receptor binding causes inflammation, which is local vasodilation and causes membranes to be more permeable and leak fluids to the surrounding tissues. This causes the swelling, congestion, redness, and edema such as runny nose and watery eyes that we associate with allergies. In the brain, histamine stimulates nerve endings, and this causes the itching and pain that is sometimes associated with allergic response. This is where typical allergy symptoms come from. So, antihistamines block the histamine 1 receptors, making the body less reactive to the histamine response. So, does this mean that antihistamines cause vasoconstriction? No. It blocks the reaction you see caused by histamines. Normal neurotransmitter metabolism and breakdown drains the histamines that were already released from the mast cells, and when this is combined with the blockage of the histamine receptors, we have a reduction in the allergic symptoms. Antihistamines do not directly cause vasoconstriction. Side effects that are commonly associated with first-generation antihistamines are likely due to the interactions with other receptors, such as muscarinic receptors and alpha receptors. Antihistamines are antagonists at the muscarinic receptors, and this results in anticholinergic side effects. The anticholinergic side effects are decreased mucus production in the nose and throat, which is actually beneficial in the treatment of allergies. But we also see many other troublesome side effects, such as urinary retention, loss of coordination, dry mouth, and blurred vision and confusion. In susceptible persons, antihistamine action at the alpha receptor may cause vasodilation leading to orthostatic hypotension and dizziness. The non-sedating antihistamines, which are the second and third generation antihistamines, have more peripheral action and are more selective for the H1 receptors due to their chemical restrictions. You'll learn more about this concept in the chemical basis of drug action class. So, what does the action of decongestants do in combination with antihistamines? The mechanism of action for decongestants is a direct action on alpha receptors, and there is some action also at the beta receptors. When alpha receptors are activated, this results in vasoconstriction. When the vessels in the nose are constricted, the nasal passages open and there is less membrane permeability, so you have less leakage of fluid or runny nose. Decongestants have little effect on beta receptors, but it may relax bronchial smooth muscle. Side effects as a result of vasoconstriction may end up in elevated blood pressure or other cardiac side effects in susceptible patients. This may be tachycardia or some mild palpitations. Decongestants are sympathomimetics, so this leads to other side effects such as anxiety, lightheadedness, and insomnia. It may be more severe in elderly or children. Topical nasal decongestants, if they are overused, may cause dependence on those products. This overuse leads to rebound congestion, causing a person to continually use that product. These products generally recommend to only use for 3 days continuously. Hopefully this clarifies some of the differences in the mechanism of action of the antihistamines and decongestants and how they are helpful in allergy treatment.